Right. So we are group 8, and this is our presentation of the Immersive Learning Group project. All right. So first I will give a brief introduction into the Opportunities for Positive Growth, Inc. So OPG is an Indiana-based group that provides a variety of services for individuals with developmental and intellectual disabilities and/or deficits. These services can include occupational therapy, music therapy, employment services, etc. OPG is currently exploring ABA, which is Applied Behavioral Analysis, as an additional service to add to their services that they provide within the state of Indiana. So ABA and BCBA. BCBA is a board certified behavior analyst, and services are based on ABA, which are applied behavior analysis techniques. So ABA therapy is based on the science of behavior, which includes how it works, environmental impacts, and how behavioral learning can impact function. ABA programs work collaboratively with an interdisciplinary team, including instructors, speech-language pathologists, OTs, and PTs, as well as family members and any other individual that interacts with this individual, to improve language and communication skills, attention, social skills, memory, and academics, while reducing problematic behaviors. So this is reinforcement techniques with a foundation in behavioral psychology that are the main treatment strategies. So ABA can be performed in a variety of settings, including schools, private clinics, in the home, etc. This would align with OPG's mission in order to facilitate community-based services to support and foster individuals in their independence. ABA can be used within the community in order to identify and modify behaviors within various functional environments. So some specific examples of this could include the grocery store, an outdoor or public space, or restaurants, which is kind of the focus of OPG, because a lot of ABA clinics are in a private setting or in the school or within the home. So this is where OPG would be unique within the community. All right. So BCBA services. ABA is an evidence-based treatment for individuals with autism, as I've mentioned. Most insurance plans do cover ABA therapy. Some different factors can be state and location, as well as insurance plan and age. So some plans that cover ABA are Medicaid, Blue Cross Blue Shield, United Healthcare, Aetna, and Cigna. A medical diagnosis and documentation of medical necessity is required, as well as documentation ongoing to show progress. This in the state of Indiana, it requires policies to cover treatment for pervasive development disorder, and that includes ASD and Asperger's. So the services that are covered under BCBA are assessment, and assessment is broken down into behavior identification assessment by the physician and behavior identification supporting assessment by a technician under a physician or other qualified healthcare professional. So assessments include face-to-face time. This also includes discussing the findings and recommendations, non-face-to-face analyzing of past data, scoring and interpreting assessment, and preparing the report or treatment plan. And this assessment is also ongoing. So that's why it is important that it's not only assessment from the physician, but also from the technician as the individual progresses through treatment. Services that are also covered include individual and group treatment by protocol under the applied behavior analysis techniques, family training, as well as group family training, and the services that specifically are covered can vary. It must be targeting a goal that is outlined in the plan of care and documented in a way that pertains to the individual goal. So this can mean that you can bill for time that is completed in an environment that is custom to the individual's behavior, which is where OPG kind of would come in their unique service delivery model.
My question was question 2, which has 2 distinct parts. First part was about issues with hiring registered behavior technicians, RBTs, and I'll discuss that first. So the question stated that there was an increase in the requirements for RBTs by the Behavior Analyst Certification Board. In my first slide here, I have the current requirements next to the new requirements that will begin in 2026. The changes for 2026 are in red. The basic requirements concerning age, education, and background check will be unchanged. However, things change a bit with training, which will be modified from a task list to a curriculum outline, with minimum time requirements for specific areas that are covered in the training. Doing that helps with standardization because different trainers might present topics differently. Trainer qualifications won't change much except for completing supervision training, and the assistant trainer needs to have at least RBT certification. The initial competency test and assessor qualifications will not change much. Next slide. So there seems to be a lot of 40-hour RBT courses out there. Many of them are online. While looking around, I found this Ball State course. This course is WIOA, which is Workforce Innovation and Opportunity Act approved. That seems to be a program for displaced workers. Anyway, the price is $2,500. I don't know if that's a major hurdle for people trying to enter the profession. While looking around, I saw a variety of different providers. Vincennes University charged about $2,000, so Ball State seems to be a bit high on the price side. Next, please. Okay, RBT maintenance requirements are not going to change much, as you can see. Wait a minute. This isn't my next slide, is it? Oh, it is. Okay, sorry. RBT maintenance requirements are not going to change much, as you can see. However, recertification is going to change significantly. This is not my next slide. This is not the right slide. Can I go back? Okay, after this one. Okay, that's not it. What's after this? Oh. Okay, somehow I'm missing a slide, I think. Can I go back? Okay, back. Okay, I don't have a slide. So I'm going to continue to talk anyway about our RBT maintenance, which is their ongoing training that they need. So it's not going to change much. However, recertification is going to change significantly. First, RBTs will certify every 2 years instead of annually. Then, instead of testing them on an annual basis, the Behavior Analyst Certification Board is going to require continuing education. So starting in 2026, the RBTs will have to complete 12 hours of in-service training, continuing education, or university coursework. Next, please. Okay. And the last issue here with RBTs was high turnover. And of course, high turnover has negative effects. Training new staff is expensive. Resources will be used to pay a trainer and the new employee. Plus, it may take a while for the new hire to get up to speed with the day-to-day doing of the job, meaning he might be a bit less productive than an experienced employee. Higher turnover also lowers morale because it disrupts bonding among the coworkers, because people are always coming and going. Finally, RBTs work one-on-one with their clients. So I think a high turnover employees can disrupt continuity with the therapy, making it harder to create rapport with the clients. Next, please. Okay. So now finally we get to the question part of my question. The question reads, what services do insurance companies reimburse related to parent training, family education, and telehealth? On this slide is the answer for the first part, parent training and family education. It says, adaptive behavior treatment, category 1. And this is the code for billing, 97156. Family adaptive behavior treatment guidance administered by a physician or other qualified healthcare professional with or without the patient present, face-to-face with the guardian or caregiver each 15 minutes. The next one, 97157, multiple family group adaptive behavior treatment guidance administered by a physician or other qualified healthcare professional without the present patient, face-to-face with multiple sets of guardians, caregivers every 15 minutes. Next, please. Okay, so now for the telehealth part of the question. So let's see. Okay, the top line says, so the only ones that are covered, 97155 and 97156 are the only two ABA services that are allowable by telehealth. So 97155, adaptive behavior treatment with protocol modification administered by a physician or other qualified healthcare professional, which may include simultaneous direction of technician face-to-face with one patient each 15 minutes. And the other one is 97156. I already read to you in the previous slide, and that was about family education. Next, please. Okay. I mean, that's not my slide. There should be two healthcare slides, telehealth slides. Go back, please.
I don't know what happened to the other one. It should be in there, but it's not.
Okay. Okay, the last slide I was going to talk about telehealth. In this slide, there's important points to know about telehealth. And I got it right here. It says credentialed registered behavior technicians, RBTs, may not deliver any ABA health services via telehealth. They can't do it. Only a only a health service provider in psychology or licensed board certified behavior analysis, BCAB, are eligible for using telehealth when supervising delivery of ABA services remotely. That's an important point. So that means the RBTs can't use telehealth if they're the ones who are remote. However, procedure code 7155 is reimbursable via telehealth only when an HSPP or BCBA is providing guidance supervision to an RBT remotely, and the RBT is rendering adaptive behavioral treatment in person to the member. So that means the RBT can be there in person, but the supervisor can be remote and doing that service. Okay, and the last one was all ABA services must include synchronous audio-visual interaction. No ABA services are reimbursable when delivered via audio-only telehealth. So that means it just can't be a phone call. You have to have a video feed as well for it to count for telehealth. Okay, now for our next speaker, Ethan.
I think it's me actually, but
sorry.
you're okay.
Sorry.
So we're talking about insurance coverages here. It gets a little complicated, especially with Indiana, just because there's been some recent changes within how it's how the ABA and things like that, especially in adults, is covered. So in 2019, the House Bill 1248 was passed, which required health insurance policies to cover autism-related therapies. However, at that point, it was currently limited to $30,000 annually for individuals up to 18. However, now they're usually covered through mental health benefits for adults, which is through Medicaid. The number of hours approved by insurance companies can vary. Indiana is one of the states that have passed the autism insurance reform laws, which requires insurance coverage for autism treatments, which includes ABA therapy. In 2022, there was actually a case, Connor Blessing versus Indiana Family and Social Services Administration. It basically covers to where autism can now maintain Medicaid for ABA therapy even after turning 21. So up until this point, it was basically if you were 18 or over 18, you had to go through other routes. And now this kind of helped those that are over 21 get some of the same benefits. Indiana's also different that they have a waiver program through Medicaid. This reimburses families for the costs of caring for their child of any age in their home. It can provide funds to facilitate independent living for an adult. It also provides therapies and behavioral support services. The only downfall, I guess, is that you have to fill out an application and be approved in order to receive those services.
All right, so now I want to talk about why online care can work for OPG. It is my belief that we are in an age where center-based care is no longer required in all cases. This is because through the COVID-19 pandemic, we saw how many services can be successfully administered online. and it's for this reason that we believe online care can work for OPG. So in the following slides, I will show how the mission and values of OPG are aligned with the goals of ABA care, and I will also offer some suggestions and show how online care can work for OPG and the people they serve. All right. So why does OPG not need a physical presence? As I said, we believe the mission and values of OPG align with the goals of ABA care. This is because OPG's mission is quote, inspiring people in the pursuit of a rewarding life, while one of the main goals of ABA care is to, quote, teach generalization of skills across settings, including home, school, work, and in the community. Now, by meeting online, individuals do not have to leave their home, school, or work to attend meetings. This can lead to cost savings for the individual receiving care, as they do not have to take time off work or school or pay for extra transportation costs. For those providing the care, they can see how the individual reacts to the environment they're in, which is work, home, school, or etc., and therefore can create a better plan for care that is more reflective of their normal environment. OPG states they will use ABA to, quote, identify problem behaviors, observe and measure, develop plans to change and monitor. Again, by administering this behavior therapy online, therapists will be better able to create plans that are reflective of the environment the individual is in. It is much more difficult to create a plan in a therapist office because you cannot physically see how they react in different environments. Next slide. Okay, so for the impact of online presence, we also believe OPG can have a major impact in rural communities by providing online care. Millions of people in the US live in rural communities that are long distances from quality care services. By administering this care online, individuals can receive the care they need without having to drive long distances and take time off of school and work. Online care can also reduce stress because, as I mentioned previously, people do not have to take time off. This can lead to a more holistic approach to care because the therapist will be better able to understand how the individual reacts in different environments and create plans to care for more specific needs. Online care can also have a great impact on parents and caregivers. OPG can provide training to these individuals online rather than in person, which again reduces stress even for more of the other people involved. Finally, online meetings provide the opportunity for collaborative consultations, as many different professionals can meet with the individual and their caregiver at the same time. Next slide. So to make online care even easier for OPG, the individual and their parent or caregiver, a portal could be created for OPG. This portal should allow for easier communication between everyone involved, even outside of set meeting times. This portal should also have dashboards to track the progress of the individual and could also provide calendars and other scheduling tools to make appointments much easier to track and manage. Finally, OPG themselves can provide training materials and other useful resources to the individual receiving care and their parent/caregiver that will help them implement ABA care techniques at home. Next slide. For the impact on parents and caregivers specifically, they can directly influence outcomes at home. They can reinforce skills and routines taught during online meetings in a comfortable and familiar setting that is not possible if only doing center-based care. The portals I discussed in the previous slide also make it much easier for parents and caregivers to track treatment and report successes and failures to the ABA therapy team. And then last slide. So how online care can work for OPG? These were the reasons we believe online care can work for OPG rather than maintaining a brick and mortar location. We saw that OPG's mission, values, and goals directly align with the goals of ABA care. We also saw how online care can lead to cost savings for both OPG and their patients. Now, it is typically much cheaper to have an online presence than a physical building, as the overhead is typically much lower for online. For the individual receiving care and their parents and caregivers, they can save time and money by not having to travel or take time off of work and school. And finally, online care can also lead to improved outcomes because it provides a more holistic approach where the OPG team can better see how the individual reacts in different environments rather than just in the office. Now I'll pass it off.
Good evening. My name is Milan. I have section 5. This section is concerning OPG's request for a presentation on the current reimbursement practices for services, ABA services provided by BCBA certified individuals. And they also wanted a focus on private insurance and private pay as their initial source of funding. So here from the per Indiana's Family Social Services Administration, we can see a wide range of reimbursement for an hour of ABA service under a BCBA, with the average being about $91 an hour. And this was in 2022. They planned a 15% increase to bring it up to $103.77 for the subsequent years. Next slide, please. So what we can see here from the Indiana's major private insurers is that most of them do cover ABA services, specifically for autism diagnosis, but several, United Health and Aetna, also provide coverage for cognitive delays of other sorts. They also, commonalities among the private insurers is that they do offer higher reimbursement. I found TRICARE from 2023 that they're reimbursing for initial assessment and meeting $135 for an hour, and then continuing treatment therapies for about $125. So well above the average of Indiana of $103. We also find among the private insurers expected treatment durations for plans. The specifics of that are Anthem likes to do 40-hour-a-week treatments for 6 months, and then any extension on time would need pre-approval. United Health seems to have it by age brackets. Anybody 7 and under would get 10 to 25 hours a week for 1 to 2 years of therapy. And then anybody over 7 years old would receive 1 to 20 hours a week for 1 to 4 years. So there is no acute monetary cap, but there is a limit as far as how many hours can be readily approved for these services. Let's see here. And then next slide, we can go. Thank you very much. So what we have here is revenue forecast. And basically we have several assumptions and several fresh data points. On average from those major private insurers, we see that an individual gets 1 to 20 hours. So I created a chart with a breakdown of 1, 5, 10, 15, and 20 hours. Private insurance tends to be on the higher end, about $125 an hour for treatment service. The ones that are specific to OPG would be those billing codes right there that are telemedicine accessible for a BCBA certified person to bill for. Fixed technologies I found to be somewhere between $7 to $11, depending on if it's telehealth from the clinician's home or from a centralized clinic that they're reaching out to the person. So we average that out to 9. OPG provided us with a 36% overhead on all revenues. And then I did a little bit of analysis and found that the average salary was anywhere between $76,000 to $81,000 for Central Indiana. So I averaged all of those. So if we look at the data charts, we can see that getting the minimum hours for 10 clients would lead us to only an operating margin of $17,420, and that's pre-tax. If the OPG decided to offer a higher rate or had trouble hiring into the positions to provide the services, that would eat into that profit operating margin early on. It only becomes quite lucrative once we get to 5 hours per clientele, as can be expected because fixed costs do less of an impact. And that is my portion of the presentation.
I think that wraps it up for us. So thank you.